Imagine this, a problem out there in agriculture. It's costing billions, causing really immense animal suffering, but it often stays hidden, sort of under the radar until it's really severe. It's like this silent drain on farms on animal welfare, pretty much globally. Today we're doing a deep dive into bovine laminitis. It's this truly debilitating hoof disease affecting cattle all over the world. Our mission? Well, we want to break down its complex causes, really show you how it impacts the animal, explore some of the coolest new ways to diagnose it, and then share the latest on treatment and, importantly, prevention. We've pulled together a pretty comprehensive review of the latest research articles, so you'll get a really thorough understanding.
Yeah, and what's really striking here is just how pervasive laminitis is. This isn't some minor sporadic thing. It's a major challenge for cattle health, for production everywhere. Huge economic and welfare implications. I mean, in dairy herds, you're looking at prevalence rates anywhere from 17%, maybe up to 35%, some European studies, even higher, maybe 72%. And even in beef cattle, while it's lower, it's still there, 0 to almost 8% of herds. Which brings us to this really crucial concept, what we call the iceberg phenomenon.
The iceberg phenomenon.
Right.
Yeah.
The cases you see, the really obvious lameness, that's just the tip. The real burden, the bulk of it, is hidden in these subclinical forms, cases that aren't overtly lame, but they're silently chipping away at profits, compromising welfare. And that's why catching it early, well, it's absolutely paramount.
Okay, right. Let's unpack that. What exactly is laminitis, like at its core?
At its core, laminitis is an inflammation, specifically inflammation of the laminae. Now, these laminae, they're specialized, incredibly intricate layers of tissue inside the hoof. Think of like thousands of tiny interlocking fingers, almost like Velcro strips, you know? Their critical job is to suspend the coffin bone. That's the third phalanx, P3, within the hoof wall itself. And this really delicate suspension system, that's what lets the hoof absorb huge forces, lets the animal walk comfortably without pain.
So these tiny structures are key for shock absorption.
Okay.
And when this inflammation gets really bad, visible, that's when people call it founder, right?
Exactly. When it gets to that severe stage, you'll hear founder, or maybe more technical terms like diffuse aseptic pododermatitis. But that iceberg idea is so important because those obvious severe cases, they're way outnumbered by the subclinical forms that just, well, go unnoticed. But these hidden cases still cause substantial economic losses. They compromise welfare silently. The visible lameness, honestly, it's just a small fraction of the whole problem. So yeah, catching it before it gets to that founder stage is vital.
Okay, so we've outlined the problem, the hidden burden. But the million-dollar question really is how? How does this devastating disease actually start? It sounds way more complex than just, a simple injury.
Oh, it's definitely complex, a multi-stage cascade, really. It involves metabolic changes, inflammation, issues with the tiny blood vessels, microvascular changes, and then structural damage. The first key process, it really starts with inflammatory and vascular changes in the corium. That's the nutrient-rich tissue that supports the laminae. It begins as aseptic inflammation, meaning not caused by external bacteria, but usually triggered by some internal metabolic insult, often something that makes the animal's systemic pH drop. And that kicks off a pivotal disruption of the microcirculation in the hoof. Think of the tiny blood vessels in the hoof like a complex plumbing system. When laminitis starts, the body releases certain chemicals, histamine, endotoxins. Initially, they might actually try to send more blood, but then paradoxically, they start diverting blood away from the tiniest, most vital capillaries. They activate what we call arteriovenous shunts.
Shunts, so like bypasses.
Exactly, like opening up bypass routes. It's like a traffic jam where the essential oxygen and nutrients just can't get through to those really delicate lamina. This leads to localized ischemia, basically, reduced blood supply, starving the tissue. We also see tiny blood clots forming, microthrombi, which block things up even further.
Wow. So the hoof itself, designed for strength, can kind of become its own worst enemy when inflammation kicks in. That sounds like a really vicious cycle, especially with the blood flow cutting off.
Precisely. And what's fascinating in a bad way is how the rigid hoof capsule, which is normally protective, becomes a huge problem here. Imagine the outer hoof wall like a rigid, unyielding box or cast.
Right, it can't expand.
Exactly. So if you get inflammation and fluid buildup inside that rigid box, even a tiny bit creates immense pressure. There's nowhere for the swelling to go. This pressure then squeezes those vital small blood vessels, cuts off circulation even more, makes the ischemia worse, and causes more cell death, more breakdown of the laminae. It's this destructive cycle. Inflammation drives ischemia worsens inflammation and tissue damage. Now, histamine's role here, It's complicated.
Okay.
So while severe acidosis at a local level in the hoof might temporarily block the breakdown of histamine, something called histaminosis, paradoxically, severe rumen acidosis leads to systemic histamine intoxication.
Systemic. So throughout the body.
Yes, because the gut barrier gets damaged, leaky, and more histamine floods into the bloodstream, and that contributes to widespread vascular damage, laminar damage, including in the hooves. So the initial acidosis sort of sets the stage for a body-wide inflammatory hit, even if local conditions might tweak histamine activity right at the hoof level.
That cascading inflammation, the internal pressure, it sounds absolutely brutal.
Yeah.
So what does that kind of internal chaos actually do to the cells? The tiny building blocks holding the hoof together, are they just giving way?
Yeah, that's a good way to put it. They are giving way.
Hmm.
At the cellular level, this inflammation causes dysfunction in the basal epithelial cells and their hemidesmosomes.
Hemidesmosome.
Think of them as the tiny anchors, like molecular rivets, holding the epithelial cells tightly to the basement membrane underneath. When they fail, that crucial attachment just weakens significantly. On top of that, there's this critical imbalance between enzymes. You've got matrix metalloproteinases, MMPs, think of them as the body's demolition crew breaking down tissue.
Okay.
Normally, they're kept in check by inhibitors called TIMPs. But in laminitis, the demolition crew, the MMPs, they basically go wild. This leads to excessive breakdown of the basement membrane, degradation of collagen, both absolutely vital components for the hoof's structure and support.
So everything starts falling apart structurally.
Exactly. And ultimately, these progressive changes lead to major structural consequences inside the hoof capsule. Specifically, we see rotation and sinking of the pedal bone, that P3 bone, rotation. That usually happens when the inflammation and damage are mainly at the front, the dorsal part of the hoof. The deep digital flexor tendon, which naturally pulls on the bone, becomes kind of unopposed because the attachments are weak. This causes the tip of the coffin bone to rotate downwards towards the sole.
And that's what leads to that weird hoof shape.
Right. That results in what people often describe as funky hoof growth or a dished foot appearance. Sinking is more severe, thankfully less common. It's a more widespread failure of the entire laminar attachment system. The whole hoof wall basically separates, and the P3 bone literally drops, it sinks distally, within the hoof capsule. Clinically, you might see a sort of halo or depression at the coronary band, and on x-rays, you'd see an increased width between the bone and the hoof wall.
So what does all this internal chaos mean for the animal in the long run? I mean, it sounds like these changes lead to visible lesions, permanent damage, obviously ongoing pain, and it must hit their productivity, weight gain, everything. And this brings us right back to that hidden burden, doesn't it? That iceberg phenomenon you mentioned.
Absolutely. That's the really insidious part. These subclinical cases, they aren't just subtle, they're the silent saboteurs. They wreck farm profitability, animal well-being. It really demands a shift in how we think about detection and management. The actual disease progression is often hidden right below the surface. There's this significant subclinical burden that just accumulates over time.
Okay, now that we understand what happens, how the damage sort of cascades, let's dig into the why. Why does this happen? You said it's multifactorial, right? Not just one simple cause.
Exactly. It's definitely multifactorial. But primary drivers are often nutritional factors.
Like feed.
Yes. High levels of rapidly digestible carbohydrates that could be from too much grain, concentrates, or even really lush, rich pasture that's a leading cause. This leads to ruminal acidosis. The rumen pH drops too low, below 5.5 for subacute, Sarah, or even below 5.0 for acute acidosis. This acidic environment, it causes a big shift in the rumen bacteria. Lactic acid producers, like Streptococcus bovis, they start to proliferate. And when certain bacteria die off in these conditions, they release endotoxins, LPS. Think of them as toxins from the bacterial cell walls.
And these get into the bloodstream.
Exactly.
Okay.
The rumen wall becomes compromised, leaky, and these endotoxins translocate across it into the bloodstream. They travel to the hoof, and that's where they damage that delicate microvasculature, leading to often permanent damage. But it's more nuanced than just too much grain.
Right.
Inadequate effective fiber in the diet is also really key. Fiber stimulates chewing, which produces saliva. Saliva is rich in bicarbonate, a natural buffer for the rumen.
So less fiber, less buffering. Makes sense.
Right. And cows can be sneaky. They can selectively sort their feed. They might pick out the tasty grain and leave the longer fiber bits, even if the ration looks balanced on paper. Abrupt diet changes are another big risk. Suddenly introducing high concentrate feeds can just overwhelm the rumen's ability to adapt. Even feed palatability matters. If feed isn't palatable, intake might drop, contributing to negative energy balance, which also raises laminitis risk. And we also know things like ingesting molded feed, mycotoxins, that can contribute too. It predisposes the animal to inflammatory responses.
Okay, so the nutritional link is clear and how the hoof's internal structures start to unravel. But it's not just about what they eat, is it? The cow's own body, its physiology, must play a huge role, especially around calving time.
Oh, absolutely. You're right. The periparturient period, that time around calving, and the first few weeks after, it's incredibly demanding physiologically. There's this intense metabolic and endocrine shift as the cow switches from pregnancy to just pouring energy into milk production. This often creates a massive energy deficit. The cow has to mobilize large amounts of body fat to cope. And this negative energy balance, it's a central predisposing factor for a whole cascade of metabolic disorders, including laminitis.
And it's linked to things like ketosis.
Very closely linked to ketosis and also fatty liver disease, often as a consequence of that subacute ruminal acidosis, Sarah, fatty liver, where you get excessive fat buildup in the liver cells. It's really common in high-producing dairy cows because of that severe negative energy balance. It's often tied to pronounced ketosis, reduced feed intake, lower productivity. We know cows with hyperketonemia, high ketones, and early lactation are at increased risk for ketosis, obviously, but also metritis, displaced abomasum, and laminitis.
All connected.
Exactly. The excessive fat mobilization, the impaired liver function, it all contributes to systemic metabolic stress and inflammation, which can directly or indirectly trigger that laminar damage in the hooves. It really highlights what we often call transition cow syndrome. Laminitis, rumen acidosis, ketosis, fatty liver, mastitis, metritis, retained placenta, they're all interconnected, like a web.
Wow.
The underlying metabolic disturbances and inflammatory responses, like those endotoxins we mentioned, are common threads. It means you really can't just treat one thing in isolation. You need holistic management, especially around calving.
That interconnectedness really drives home the complexity.
Mhm.
What about other things, like infections or other inflammatory conditions? How do they play into this?
Yeah, good question. Laminitis often follows other systemic inflammatory diseases, things like septic pleuropneumonia, metritis, uterine infection, and of course, severe rumen acidosis itself. A key mechanism here, again, involves those endotoxins, LPS.
That one's from the gut.
Often from the gut in acidosis, yes, but also from gram-negative bacteria involved in uterine infections like metritis or even severe mastitis. Once these endotoxins get into the bloodstream, they cause direct damage to the microvasculature of the corium in the hoof, leading potentially to permanent damage. So any systemic inflammatory response triggered by endotoxins is a really powerful driver of that laminar pathology. And concurrent diseases, mastitis, metritis, displaced abomasum, they all increase the laminitis risk simply because of the inflammation and metabolic stress they create.
Okay, so we've got nutrition, metabolism, infections. What about the cow's environment, the housing, daily management? How much does that play a role? Yeah.
Oh, environmental and management factors are huge, really significant. Suboptimal housing conditions are major risk factors. Think about hard surfaces like concrete. That increases mechanical stress on the hooves day in, day out. A lack of suitable bedding or restricting their movement, that contributes too. Overcrowding is another one. And limited feed bunk space. That can lead to reduced feed intake for some animals, increased competition, more stress. It all exacerbates metabolic issues.
So what are the fixes there?
Practical solutions. Things like resurfacing or grooving concrete floors for better traction and maybe a bit more give, using rubber flooring in high traffic areas like near the milking parlor or feed bunk, and just fundamentally maintaining clean, dry feet and good overall cow comfort is key.
So minimizing the time they spend just standing around is a big deal then.
Absolutely. Minimizing time spent standing, especially on hard surfaces like in...
Okay, so we've got the causes, the cascade of damage. How do we actually know if an animal has laminitis? It sounds like it presents differently depending on severity, and often maybe it's not that obvious.
It definitely presents differently. For acute laminitis, the signs are usually dramatic. Sudden, severe pain. Animals are really reluctant to walk. They adopt this abnormal stance, kind of drawing their feet under their body. They might have a fever, maybe up to 40 Celsius, increased breathing rate, warm hooves, and often a really pronounced bounding digital pulse you can feel. They have that classic walking on eggshells gait we mentioned earlier.
Yeah, right.
In severe cases, they'll lose their appetite, maybe even become recumbent, unable or unwilling to stand. Then you have subclinical laminitis. This is the insidious one, often goes totally unrecognized.
The hidden part of the iceberg.
Exactly. The animal won't show overt lameness, but you might spot subtle gait changes if you look really closely. The real clues are often found during hoof trimming or inspection. You'll see characteristic changes in the hoof horn. Maybe softened sole horn, a yellowish discoloration, signs of hemorrhage bruising in the sole or along the white line. The dorsal hoof wall might look a bit concave or have ridges. And despite being hidden, remember, these cases cause significant production losses, lower milk yield, poorer fertility, higher culling rates. This is the vast majority of that iceberg. And finally, there's chronic laminitis. This is the long-term consequence of repeated episodes, or one really severe one. You'll typically see changes in hoof shape, the classic slipper foot appearance where the claw gets wider and has a dished concave profile. The angle at the front, the dorsal hoof angle, is reduced.
You see lines on the hoof too sometimes.
Yes, founder rings. These are horizontal growth arrest lines on the hoof wall. They show where growth basically stopped during previous inflammatory events. The horn itself can be soft, rough, poor quality. And this chronic form is often associated with secondary problems, things like sole hemorrhages turning into sole ulcers, which can lead to deeper infections. White line disease, where that junction weakens and separates, allowing dirt and infection in. Hoof wall fissures or cracks. The long-term damage is often permanent, causing ongoing pain and impacting their productivity and weight gain indefinitely.
So given that range, especially the hidden subclinical stuff, how do veterinarians actually diagnose this? When there isn't obvious lameness, what are the tools?
Diagnosis often needs a multi-pronged approach. First off, there's the clinical examination and lameness scoring. This involves assessing the animal's general condition, checking their temperature, carefully observing their gait, usually using a standardized 5-point lameness scale and using hoof testers. Those are like pliers used to apply pressure to specific parts of the hoof to pinpoint painful areas. But as we've said, for conditions like subacute ruminal acidosis, SARA, which is a major trigger, the symptoms are often vague, maybe delayed, so you're often looking for a pattern of subtle signs, not one single smoking gun.
Next up, imaging techniques. Especially radiography x-rays. These are invaluable for seeing what's going on inside the hoof.
What can you see on an x-ray? X-rays can reveal those structural deformities we talked about. Rotation of the pedal bone, P3. You might see radiolucency, which looks like darker areas at the tip of P3, suggesting bone loss or inflammation. You can see that concave claw profile, sometimes called the ski jump sign, where the bottom edge of the bone curls up. In severe cases, you might see that distal displacement, the sinking of P3. That's shown by an increased distance between the bone and the coronary band, or sometimes a sort of halo appearance around the bone on the X-ray. Then there are laboratory diagnostics. Blood biomarkers can give objective data.
Like what?
We can look at inflammatory markers, things like C-reactive protein, CRP, certain interleukins, ILs, serum amyloid A, SAA. These are often elevated in lame cows, indicating inflammation somewhere. For ruminal acidosis specifically, an increase in a liver enzyme called aspartate aminotransferase, AST, can sometimes suggest liver damage associated with the acidosis. But it's worth noting some of the general metabolic blood tests don't always show a direct, clear correlation with rumen pH, so there are limitations with some of the broader panels.
Now this is where it gets really interesting. What about new ways? Pushing the boundaries of detection, especially early detection. What's emerging?
This is a very exciting area, actually. There's promising work on novel biomarkers using cerumenomic assays.
Cerumenomic, what's that?
Cerumen is earwax. So cerumenomics is basically analyzing the volatile compounds, the chemicals, present in earwax.
Earwax, seriously.
Seriously, it's a non-invasive innovation, and early research suggests it can detect volatile metabolites that are indicative of laminitis. Specific candidate biomarkers have been identified. For example, a compound called picresol shows strong diagnostic potential. It had an area under the curve, or AUC, of 0.845 in one study.
AUC, what does that mean?
AUC is a measure of diagnostic accuracy. 1.0 would be perfect, more 0.5 is basically chance. So 0.845 is actually very good. Even more impressively, another study looked at a panel, a combination of 8 different volatile compounds found in earwax, with one called formamide being the most prominent, and this panel showed very high accuracy, with an AUC of 0.97.
Wow, 0.97 is almost perfect. A non-invasive earwax test for laminitis. That sounds almost like science fiction. How significant could this be?
The significance could be enormous. I mean, think about it. A non-invasive, potentially simple test. It offers a practical tool for what people are calling precision farming. It completely overcomes the invasiveness of something like a liver biopsy or the limitations we see with some blood markers. It could potentially revolutionize early detection. Imagine being able to identify animals at risk or in the very early stages of subclinical laminitis before any major damage or clinical signs appear.
That would allow for really timely interventions.
Exactly. Timely interventions could significantly improve animal welfare, drastically reduce the economic impact by catching all those hidden subclinical cases. It could truly transform how we manage herd health proactively.
Okay, so detection is key. But once an animal is diagnosed, what's the path to recovery? It sounds like it could be quite a long road, depending on the severity.
It can be. Effective treatment is definitely multi-pronged. First, you need immediate interventions and supportive care. Pain management is absolutely crucial. Using NSAIDs, nonsteroidal anti-inflammatory drugs like flunixin miglumin or ketoprofen or meloxicam, they reduce pain and inflammation. Sometimes sedatives might be needed for safer handling and just to reduce stress for the animal. Environmental adjustments are also key. Strict box rest, confining the animal to a small, comfortable area is often necessary, and providing deep, soft bedding like sand or lots of shavings is vital to relieve pressure on those painful hooves.
Taking the weight off, essentially.
Precisely. You also need to minimize overall stress, make sure they have easy access to food and water. Nutritional support is important too, a balanced diet for immune support, maybe specific supplements. And often, a low-carbohydrate diet helps manage underlying metabolic issues like hyperinsulinemia that might be driving it. Then there's corrective hoof care. Therapeutic trimming by a skilled trimmer is critical. The goal is to restore proper hoof conformation as much as possible, achieve even weight distribution, and prevent further damage or abnormal growth. Often, hoof blocks or lifts are applied to the unaffected healthy claw on the same foot.
To the healthy one, why?
By raising the healthy claw slightly, it lifts the injured claw off the ground, relieving pressure on it almost completely. It essentially gives the damaged hoof a break, allowing it to heal without the constant mechanical stress of bearing weight. And critically, you absolutely must address the underlying causes.
Right, go back to the source.
Exactly. If ruminal acidosis is the trigger, that means immediate dietary changes, usually providing good quality hay, removing concentrates. Oral alkalizing agents like sodium bicarbonate can help buffer the rumen. In really severe acidosis cases, rumen transfonation might be considered. That's transferring rumen fluid from a healthy donor cow to try and restore beneficial bacteria. Antacids, IV fluids, might also be needed. And of course, managing any concurrent diseases, mastitis, metritis, is essential. Sometimes thiamine supplementation is given for acidosis complications, as thiamine is important for carbohydrate metabolism.
That's quite a toolbox. Are there any groundbreaking new treatments on the horizon? Anything that might really change how we approach treatment itself?
Yes, there is some exciting research into emerging therapeutic approaches. One compound that showed promise in recent research, I think it was 2024, is called methylated tyrolizide, or PTP-102.
PTP-102, what does it do?
Well, it's shown promise in inhibiting those MMPs, remember the demolition crew enzymes?
Right, the ones that break down tissue.
Yes. So it inhibits MMPs and seems to promote laminar tissue repair, at least in lab studies, in vitro, and also in equine models in horses. Studies showed it improved clinical signs, reduced inflammatory markers, and even had a positive influence on the gut microbiota in those models. Interestingly, it seemed to have a better effect when used as a treatment after laminitis started, rather than as a preventative beforehand.
So more for fixing the problem once it's there.
Potentially, yes. Now, this is currently mainly in equine models, but it certainly paves the way, opens the door for potential bovine application down the line.
Okay, so treatments are vital once laminitis strikes, obviously. But what's the best strategy in the long run? It really sounds like prevention must be far more cost-effective, right?
Oh, absolutely. In the long run, prevention strategies are, without a doubt, the most cost-effective approach. It's all about avoiding the problem in the first place. This really starts with nutritional management. Optimizing the diet is key. Ensuring adequate fiber, aiming for minimum levels like 19% acid detergent fiber, ADF, and 28% neutral detergent fiber, NDF.
Remind us what ADF and NDF are.
Right. ADF is basically the tougher, less digestible fiber fraction cellulose, lignin. NDF is the total fiber, including hemicellulose. Ensuring adequate levels, especially effective fiber, long enough particles, stimulates chewing, saliva production, which naturally buffers the rumen. It also means avoiding excessive concentrates, especially rapidly fermentable ones. Implementing gradual diet changes is crucial. Allow maybe 3 to 5 weeks for the rumen microbes to adapt to new feeds or forage changes. Proper grain processing matters too. How finely it's ground affects how quickly it ferments. And strategic use of feed additives can help. Things like buffers, sodium bicarbonate, magnesium oxide. Direct-fed microbials like specific yeasts or lactobacilli strains can help enhance lactate utilization, preventing pH drops. Ionophores like monensin can also help stabilize the rumen environment by selectively inhibiting certain bacteria. Body condition score, BCS management, is also absolutely critical. Cows should ideally be at an optimal BCS around 3 to 3.5 on the standard 1 to 5 scale, both at dry off and at calving.
Not too thin, not too fat.
Exactly. Avoiding both extremes is key, as both under and overconditioning create metabolic stress that increases risk. Regular BCS monitoring allows for targeted feeding adjustments. Then there's environmental and housing management, which we touched on earlier, providing optimal floor surfaces, grooved concrete, maybe rubber mats in key areas. Maintaining clean and dry feet is vital to prevent secondary infections. Minimizing stress and excessive standing time, especially in parlor holding areas during lockups. Managing those environmental stressors like heat, flies, maybe even cold stress. Good ventilation, comfortable resting areas, it all contributes. And finally, good herd health and biosecurity practices. This includes routine, functional hoof trimming by a skilled professional. Optimizing transition cow health is paramount, as we discussed. Preventing common infectious diseases that can cause systemic stress like BVD or IBR. And as mentioned, potentially using genetic selection, looking at predicted transmitting ability, PTA values, for lameness resistance when choosing sires. This allows producers to gradually breed for animals that are naturally less prone to lameness issues.
Are there any truly novel preventative measures emerging? Things that maybe target those underlying metabolic problems more directly?
Yes, there are a couple of exciting developments in that area too. Probiotics, for instance. We're seeing more research on their potential role in treating liver diseases like fatty liver, NAFLD, ALD, cirrhosis, which we know are strongly linked to laminitis risk via metabolic disruption.
So helping the liver helps prevent laminitis indirectly.
That's the idea. By restoring gut microbiota balance and reducing systemic inflammation originating from the gut, probiotics could indirectly contribute to laminitis prevention by improving liver health and overall metabolic stability. Specific bacterial types like bifidobacterium and combinations like Lactococcia bacillacea and Lamasa lactobacillus reuteri have shown promise here. Another really novel approach being investigated is the SIMCJ drug.
SIMCJ.
It's a drug based on small interfering RNA technology. It aims to downregulate or turn down a specific protein called MCJ, primarily in the liver. This MCJ protein seems to play a role in the development of fatty liver disease.
So stopping fatty liver before it starts.
Exactly. Since fatty liver is such a significant metabolic disorder predisposing cows to ketosis and then laminitis, effectively mitigating it could indirectly contribute to laminitis prevention by tackling a key metabolic imbalance right at its source. Early studies are looking at making this an affordable, practical treatment for commercial use.
Okay, let's shift gears slightly and talk money.
Yeah.
This disease clearly has a huge impact on animal welfare.
Yeah.
But what's the actual financial toll on the industry? You mentioned billions earlier. Is it really that high?
The economic burden is truly substantial, and it comes from both direct and indirect costs. Direct costs are the ones you can easily quantify. The extra labor involved, vet bills, medications, maybe discarded milk due to drug withdrawal time.
Okay, the obvious stuff.
Right, but the indirect costs, which are often hidden, typically outweigh the direct ones by a significant margin. These include things like reduced milk yield, lame cows just don't produce as much, impaired fertility, it takes them longer to get pregnant again, conception rates drop, increased culling cows, leaving the herd prematurely because of lameness, and the risk of recurrence or spread within the herd. And crucially, those subclinical forms we keep mentioning, they are a huge part of these hidden indirect costs, silently eroding profitability day after day. The variability you see in cost estimates just highlights how complex it is to capture that full financial impact accurately.
Can you give us some specific figures, just to put it in perspective?
Sure. Estimates for a single case of clinical lameness vary, but they often fall somewhere between, say, $76 and $533 per case. A commonly cited average from recent years is around $337 per case.
Wow, that's significant for one animal.
It is. And think about this. Each additional week a cow remains lame costs an estimated $13 to $18 in lost productivity. So, for example, a 300-cow dairy, maybe with a 20% annual incidence rate of lameness, which isn't uncommon, could be facing well over $5,400 annually just from those direct and immediate indirect costs. If we look at digital dermatitis specifically, another common cause of lameness, cost estimates per case range from around £80 in the UK, maybe €200 in Ireland, $130 to $210 in the U.S. Nationally, just digital dermatitis is estimated to cost the U.S. cattle industry something like $1.4 billion a year.
$1.4 billion, that's staggering.
It really is, and the production losses add up quickly, too. Milk yield. Severe lameness can knock 770 to maybe 935 pounds off a cow's 305-day milk yield. Clinical DD can reduce daily milk by about 5.5 kilograms of energy-corrected milk per day for up to 3 weeks. Fertility. Lameness can increase the time it takes to get pregnant again, the calving to conception interval by up to 25 days. It can decrease conception rates by 6 to maybe 13%. Culling. Cows with sole ulcers, a common consequence of laminitis, have a 56% higher risk of being culled from the herd, and weight loss. Lame cows just don't eat as well, don't move as much. They can lose a significant amount of body weight, maybe 6.6%, which could be over 40 kilograms, or nearly 90 pounds.
It paints a pretty stark picture. That clearly shows the immense and, like you said, often unrecognized financial drain that bovine laminitis puts on the entire industry. It's like a silent thief, stealing profits and damaging well-being. So let's try and bring this all together. Bovine laminitis. It's clearly complex, it's pervasive, it's got profound implications for animal welfare and farm economics worldwide. We've explored its subtle beginnings, that whole cascading damage it inflicts, the many factors that cause it, and some really exciting new ways we might detect and intervene.
Yeah, what's absolutely clear is the need for a concerted effort really across the entire cattle industry. For veterinarians, I think it means prioritizing proactive diagnostics, really embracing regular lameness scoring, maybe exploring things like those seromonomic assays as they become available, and implementing integrated herd health plans that look at the whole system: nutrition, environment, health. For livestock producers, the focus really has to be on stringent nutritional management, getting those diets right, optimizing housing and cow comfort, prioritizing routine, high-quality hoof care, managing body condition score carefully, especially around calving, and maybe even considering genetic selection for lameness resistance over the long term. And for researchers, well, the mission continues. We need to keep digging into the pathogenesis, how exactly it happens. We need to validate these novel diagnostics like seromonomics, make sure they're reliable and practical, develop more targeted, effective therapeutics, and conduct really comprehensive economic studies to truly understand the full ongoing burden of this disease, especially the subclinical forms.
And maybe here's a final thought for you, our listener, to mull over. If something as simple as an earwax test could potentially revolutionize how we detect a widespread and devastating disease like bovine laminitis, what more could we uncover in animal health? What other breakthroughs are waiting if we start looking beyond the obvious symptoms and truly embrace these kinds of precision tools for proactive preventative care?